Animal-Assisted Intervention, a Dynamic Therapeutic Experience, presented by Christine Hellstrom, occupational therapist. Area of practice. My plan is to implement animal-assisted intervention during physical therapy and occupational therapy treatment in an acute hospital setting. Cary Medical Center is a 65-bed acute care hospital located in Caribou, Maine. Patients who are admitted to the hospital often receive physical and occupational therapy treatment in the inpatient setting. These therapy services are provided to patients who need to demonstrate improved range of motion, strength, endurance, balance, ambulation, transferability, and overall self-care ability prior to being discharged safely home. The PACE model. There are many factors to take into consideration when involving animals in traditional therapy interventions. The PACE model outlines this dynamic relationship between the practitioner, the animal, the client, and the environment. The PACE framework in my setting. Within the hospital environment, during implementation of physical and occupational therapy treatment, the PACE model includes the practitioner, the physical therapist, occupational therapist, and the dog handler. The animal, which would be the miniature poodle or the facility dog. The client, which would be the patient receiving PT and or OT services. And the environment, which is the acute hospital setting, specifically the patient room or hallway. Involvement of canine species to achieve therapeutic outcomes. My goal is to form a partnership with the facility dog as an adjunctive method to traditional therapy. I believe that involving animals in animal-assisted intervention will assist with increased motivation for patients to participate in treatment, increased ambulation distance, increased range of motion of upper and lower extremities, increased endurance, decreased perceived rate of pain, improved balance, improved functional self-care, improved cognition and communication. There are many reasons I chose to partner with a canine species, specifically a miniature poodle. Poodles have a hypoallergenic coat comprised of hair and not fur. They are relatively small and easy to transport, weighing between 10 and 15 pounds. They generally have a calm and comforting temperament, and they are intelligent animals and follow commands. They are also easily redirected, especially when provided with positive reinforcement. They have a playful nature which elicits human physical interaction, and they enjoy resting and cuddling, which elicits an overall sense of calmness in the patient. Challenges involved with incorporating this animal. Not all dogs are considered a good candidate to be involved with animal-assisted intervention. It is very important that a handler and or the organization partner with a dog who has demonstrated the ability to interact in an appropriate and safe way with patients. Some behavioral challenges include the following: timid behaviors such as cowering, trembling, or retreating from the patient or hospital room. Anxious behaviors such as excessive panting or licking. Too energetic, especially near patients with decreased balance or difficulty with ambulation. Excessive barking, and agnostic behaviors such as snarling and growling. The role of the environment and associated challenges. The hospital environment is a specifically challenging environment in which to incorporate animal-assisted intervention, largely due to the following. There's noxious auditory stimuli to include call bells, overhead paging systems, IV pump alarms, and bed alarms. There are multiple people in and out of the patient room to include doctors, nurses, nurse assistants, radiology technicians, patient family members, and more people. The hospital room is a confined space with lots of medical equipment to include hospital bed, tray table, commode, ambulation devices, wheelchairs, IV pumps, and nursing carts. And there are also noxious odors to include disinfectants on all surfaces frequently throughout the day. Welfare concerns. There are many welfare concerns to keep in mind when working with animals. First and foremost, their health. During animal-assisted therapy sessions, the handler should monitor for injury and provide protection to the animal. The environment. The animal-assisted therapy environment should provide adequate space for the animal to be able to retreat if necessary, adequate lighting, a safe walking surface, and controlled temperature. The dog should be provided with a safe resting space and access to the outdoors for elimination before and after animal-assisted therapy sessions. Nutrition. Adequate food and water can be provided to the dog before and after treatment sessions. Behavior. Before and after animal-assisted therapy sessions, the dog should be provided with opportunities to participate in natural behaviors such as playing, exploring, running, resting. Mental state. Observation by the handler during animal-assisted therapy sessions through use of an ethogram to ensure the dog is not experiencing anxiety, fear, or stress due to environment or client interactions. Specific therapeutic goals that can be met with animal-assisted intervention that are more difficult to meet without animal partnerships. Some patients in the hospital setting are extremely hard to motivate and often refuse to participate in PT and OT treatment. If the patient is willing to partner with a therapy dog during treatment sessions, it may result in an increased chance of meeting therapeutic goals, such as increased ambulation distance due to the enjoyment of walking with a dog, increased endurance due to actually participating in therapy, increased range of motion of extremities due to reaching for the dog, petting the dog, and grooming the dog, decreased perceived rate of pain due to distraction while interacting with the dog, and an overall sense of calmness and decreased anxiety during the session, and improved balance due to core strengthening while sitting on the edge of a bed and interacting with the dog. Role of the environment in which AAI takes place. The environment does play a role in animal-assisted intervention. Within a hospital setting, it is important to ensure safety of the dog by removing potentially dangerous items within the environment, such as spilled medications, cords across the floor, access to patient food, rolling medical equipment which may roll on the dog's paws, needles, and other items. The environment, however, can also be an asset. For example, within my hospital, there is a glass door which overlooks a large outdoor space. This door is at the end of a hallway. The beautiful view of the outdoors could entice both the dog and the patient to ambulate down the hallway. How does the environment play a role? During animal-assisted intervention, the hospital room environment may be inspected a bit more closely than during implementation of traditional PT and OT treatment. Dogs are inquisitive animals, and they may explore the environment and bring attention to details that may have been missed during traditional therapy. Also, incorporation of views of natural settings, such as the view out of a window, may be utilized more frequently during animal-assisted intervention sessions than during traditional therapy. How to develop animal-assisted intervention further in my field of practice. Continued research needs to be completed in the field of PT and OT in an acute hospital setting in order to assist with increased acceptance as an adjunctive method to meeting therapeutic goals. I personally want to continue to learn more about methods for a dog to be involved in PT and OT treatment in order to meet therapeutic goals. I also want to learn more about functional tools that can be used prior to and after implementation of animal-assisted therapy sessions, which may provide objective measures indicating concrete evidence of patient improvement with regard to quality of life, depression, endurance, etc. And I'd like to learn more about policies and procedures to implement in order to protect the safety of both the animal and the patient. Thank you for attending.